So my approach to addictions has developed significantly over the past 6 years. The best addictions counselors have suffered addiction in some form. They don't necessarily have to have suffered it to a point where their life completely fell apart, but they need to understand the addictive mind. There is no possible way, I believe, that any addictions counselor who has not suffered addiction on some level can truly identify with the addict. And that is something that I can do. I suffered addiction myself, and it was pretty significant and did last many years. Most addictions or compulsive behaviors are done in response to a feeling. They're done in response to depression, or they're done in response to anxiety, or they're done in response to a trauma that they experienced at some point. And the addictive mind has grown in response to that problem. With addictions counseling, you have to have somebody in your life that is willing to go the long haul. This is one of the issues and problems, I believe, with short-term treatment, with 28-day programs, that although they are great in breaking the initial acute phase of recovery, that without proper counseling after that 28-day period, the chances for survival, or the chances for long-term recovery, are dismal. Addictions and compulsive behaviors are the same. I've worked with individuals who have eating disorders, and I've worked with compulsive behaviors also. The big component to understand in all of it is that the behavior, it really doesn't matter what the drug of choice is or what the behavior of choice is. The individual does something over and over again, feels large amounts of shame and guilt around it, and can't stop for whatever reason. And a big component to my program is having those individuals understand the addictive mind, and that the addictive mind is not all of your mind. It is a portion of your mind, and it's a portion of your mind that can be controlled. All of my approach to addictions counseling is about the long haul. It's about being with the individual for whatever amount of time it takes. I have addiction clients that have been working with me for 3-4 years. When they began treatment with me, they may have been seeing me weekly, some of them even more than once a week, but that by the time we get to 2-3 years, they may only be seeing or talking to me once a month. The key to my program is the consistency and the feeling that there is somebody there for you day or night. I will go as far as is required for that individual. There is a monetary side to that, obviously, but with most private addiction programs at this point, it's not unusual for individuals to be paying between $20,000 and $50,000 for programs that last between a month and 2.5 to 3 months. Once we have resolution around the traumatic event or the body, if it's an eating disorder, around the body image, then the desire to eat or to act out begins to fade. Using meditation and using self-hypnosis or guided hypnosis aids in the entire process, and that you're given a tool now that begins to become part of your life. The individuals get recovery, and they get control, and they get understanding as to why they do what they do, why they don't need to do it anymore, and begin to live a life of freedom.